I think all of that is exactly the kinds of things that I was hoping to hear from you, which is that, that there's a time and a place for modern diagnostic tools, but that there's this added element um, that physically being in touch with someone, especially I think that there are very specific contexts like pregnancy, which is why I was so pleased that we could discuss that. And you mentioned very cursorily that you've worked with midwives across the world. I wonder if we could just stick on this topic just for a little while longer, because I do think that there are places in which midwives are trained differently and where they have a slightly more maybe holistic view of their art. Um, the one thing I'd also like to just hint at is that there's something about the experience of these hands. And when delivering my second baby, I had to go to the hospital, and I had a Ukrainian doctor who had obviously had to practice medicine in a similarly underfunded or in a context without very many tools at her disposal. And so she was measuring me up on, by feeling around and figuring out what the birth weight would be. She did a couple calculations in her head and started, feeling things around. And I think she was closer in grams than they had calculated through the ultrasound. So,
Mm.
but more importantly, I had a feeling that these hands knew what they were doing.
Hmm.
And so a lot of the work that we do in our lab is about trust in technology, trust in others. And I wonder if there isn't this feeling that you get, and maybe you had the opposite with these, you know, underconfident hands of your most recent midwife, that we get a really good sense on the receiving end whether these are hands we can trust. So it can obviously go in both directions. You can have hands that are touching you to diagnose you that are experienced and know what they're doing. And I think I'm trying to sort of lead you into a question about your experience in Ecuador with these midwives who probably haven't had access to as many of the diagnostic tools that we've been talking about. So they've had to get good at using these. So I wonder if you could talk a little bit about that experience.
Yeah, absolutely. It's probably my favorite thing to talk about is just the tremendous clinical expertise that these midwives that I was really lucky to do a lot of my work in my master's process, and then afterwards just spend time with them because of just how much of an important resource they are. And I'm still well connected to one of them who I said, I wish you had a visa to come here and be with me for the delivery. And she's ready. She said, just call me and I'll be with you on the phone. And, and that was very touching, even though, ironically touching, despite the distance and despite this being on the phone. But there was something in me that moved hearing that reassurance from her, and kind of that boost of confidence of, yes, you can do it, and this is what you're up against. And um, there, the clinical medicine and the type of care provided in Ecuador, in that specific group of Quechua women in the Amazon region that I was in, was something I hadn't experienced before in medicine, even in places where touch is appreciated, even when you have kind of the gentlest of healthcare providers. Uh, and so much of it has to do, I think, with the fact that this is a group of women. These midwives are traditional midwives, so they have no official diplomas or certificates that were handed to them. They never went to a specific school to get what they earned. It's they studied for many of them, from their childhood with their parents, grandparents, and communities, and then stayed in their communities to serve the very communities they learned from, in traditional ways, in midwifery, but also in curanderismo, so healing with plants, healing with traditional Quechua ways that they had inherited from their parents and grandparents as well. And so the 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 element of touch is really at the heart of everything they do, or is something where you don't differentiate. We speak about the mind body duality in biomedicine, and how we've created that sort of barrier between what is the mind, what is the body. Uh, in Quechua midwifery context that I've experienced, there's really no beginning or end. There's no differentiation between what is psychological, what is touch, what is body, what is mind, what is, these categories that we've made to facilitate our way of understanding the medicine we've ended up with as a Western sort of society. But there, in that context of midwifery in the Amazon, it was all just one package. That is, the midwife knows what the patient is needing through using her hands, through using her ways of knowledge that are very hard to quantify in words for me, because I remember one of the first things I was told when I was observing with them is, don't expect us to teach you with words. Here you learn by seeing. Look at the plants, look at the soil, look at the houses, look at the people, and you'll learn what we're doing here. But I shouldn't expect to ask, what is this plant? And this is what this plant is, and this is what it does, and so this is how medicine is. And so to relate that to how their physical exam part is, it's not that they just know how to use their hands to know where the uterus is at or the position of the baby's head, but they have a way of using their hands to know what to anticipate. Is the mom scared? How much of fear is dominating her control of her body right now? Where is she right now psychologically, through their physical exam of her status when she comes in labor? No, and how can they use their hands as part of the exam, but as also part of the management approach that they have when a mom is feeling anxious? The sort of rhythmic application of a plant to her back or to her thigh suddenly creates an atmosphere that is so soothing in the labor room. It was, some of the most fascinating births I've witnessed were in the Amazon, with the traditional midwives that I was with, because it was all just so surreal that I had experienced the birthing process of my patients, not, and some not my patients, sometimes just observerships as a medical student, that I recall from my time in Tanzania and Nepal, where um, the context of the labor room in a very Western-like setting would be loud and anxiety and fear-driven, and this place in the Amazon was everything the opposite. No, it was a very simple room. Everything was just about the breath, was about synchronizing, harmonizing. And they created that through the movements that they had on the patient directly, with how they approached the exam, but also how they moved about the room, how they related to each other, how the midwives interacted with each other, and all of that just sticks in my mind in terms of how the atmosphere for birthing, for healing in that setting, even postpartum, is often made. So I don't know if I answered the question, because it's just
And
an
then
endless
some.
topic for me.